COVID-19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy. To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70
The following is a COVID-19 update statement by Minister for Health, Social Security and International Business, the Honorable Nickolas Steele.
Good evening, brothers and sisters. Today, Saturday, March 28th, 2020, I announce that 2 more laboratory-confirmed cases of COVID-19 on mainland Grenada have been diagnosed. This brings the total confirmed cases of COVID-19 to 9. Of that number, 1 is an imported case, and the other is likely an import-related case with relatives who were visiting from New York. The new cases are as follows. A 72-year-old.
A protected area is a clearly defined geographical space, recognized, dedicated, and managed through legal or other effective means to achieve the long-term conservation of nature with associated ecosystem services and cultural values. The terrestrial protected areas of Grenada include Annandale Forest Reserve, Grand Bras Forest Reserve, Grand Etang Forest Reserve, High North Forest Reserve in Carriacou, La Vera Ramsar Site, Mount Gazo Forest Reserve, Mount Hatman National Park and Dove Sanctuary, Mount Morris Forest Reserve, Mount St. Catherine Forest Reserve, Perseverance Protected Area and Dove Sanctuary, Richmond Hill Forest Reserve. Forests play an important role in protecting Grenada's biodiversity. Respect protected area policy and regulations. Help secure our forests now for our future.
A message from the Jeff UNDP Ridge to Reef Project and the Ministry of Agriculture's Forestry Department.
To the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy. To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70% is ideal. When you cough or sneeze, cover your nose and mouth with a flexed elbow or a tissue. Dispose of the tissue immediately and then wash your hands. If you notice someone has a fever and cough or other symptoms of respiratory illness, avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.
At first, you might think it's a cold, and it could be, but COVID-19 could escalate. Here's what you need to know. According to the World Health Organization China Joint Mission on COVID-19, as of February 20th, 80% of laboratory-confirmed cases were mild to moderate, 14% were severe, and 6% were critical. Just to be clear, a mild case of COVID-19 is not like a mild cold. The symptoms will still be pretty severe, Anything less than needing oxygen puts you in this category. Severe cases do need supplemental oxygen, and critical ones are defined by respiratory or multi-organ failure. The symptoms, treatments, and timelines of having the disease vary, depending on which category patients fall into. So let's break down what having COVID-19 looks like day to day for each level of severity. It can take as few as 2 or as many as 14 days after being exposed to the novel coronavirus for the first symptom to develop.
COVID-19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes
The following is an address to the nation by the Honorable Nickolas Steele, Minister for Health, Social Security and International Business.
Good evening, fellow citizens. Only a few short days ago, the Prime Minister and Minister of National Security addressed you, urging you, the beloved people of Grenada, Carriacou and Petit Martinique, to work with us so that we have a shot at winning the deadly battle against COVID-19. We all recalled when the Prime Minister invoked those vivid, heart-wrenching images of dead bodies and sick people lining corridors from China to Italy to Spain to Iran and elsewhere around the world. In some of the most developed countries around the world, we have watched together as healthcare systems have reached their breaking point, with this disease wreaking havoc on resources. I am sure you have seen the infestation centers that are now the United Kingdom and the United States, our two biggest Grenadian diaspora communities, and from which all of our cases so far have originated. In major countries of the world, streets are deserted, playing fields are abandoned, business places are shut down, neighbors are in lockdown. Here in the state of Grenada, we closed our borders to the rest of the world a week ago. We subsequently announced our first case. The Prime Minister and Minister of National Security immediately went further and recommended that the Governor General to declare a limited state of emergency in Grenada, Carriacou and Petit Martinique. This was designed to convey to you the seriousness of the health threat we now face. A day later, 6 more cases were diagnosed. As Health Minister, my team and I have begged you to stay indoors, observe social distancing, wash your hands frequently, do not touch your eyes, nose and mouth with unclean hands. Furthermore, cover your nose and mouth when you sneeze or cough. Above all, we sounded the one foolproof measure. Practical or practice social distancing. Sadly, many have not heard us. Many have ignored us. What is more alarming, they have ignored the medical experts, and they have seemingly blocked out the gruesome images of the impacts of this virus that they have seen around the world. Those images alone should have been enough to show you how very dire the situation is, and that we are not to take the chances that many of you continue to take. Sisters and brothers, our most important roles in government are to listen to our people and to protect our nation. This is why the Prime Minister and Minister of National Security is acting aggressively and decisively. The security of Grenada, Carriacou and Petit Martinique is compromised. Our security is compromised in a way that it has never been before. Lives are at stake. Your life is at stake. Your grandmother's life is at stake. Your father's life is under threat. My life and that of my family are under threat. So is my neighbor's. Whole families stand to be wiped out. From the halls of the palace to the seat of the Prime Minister to the village slums, COVID-19 has shown that it respects no one. And every time you venture outside of your house, you put yourself and others at risk. Every time you leave your house, you are in danger of getting infected or killed. Every time you break or ignore guidelines to quarantine when you have been exposed, you are potentially taking the life of one of our citizens. Maybe you are prepared to take that gamble, but unfortunately, it's not only to your detriment, you are endangering the lives of each of us. The Prime Minister said before, and I repeat tonight, our administration is not in the business of gambling. We are not in the business of taking lives. Everything else pales in comparison to the health and well-being of a nation. This is not about economics. This is about saving lives. This is about public health, public safety, and public order. To that end, the beach parties end. The bar gatherings and boat parties end. The crowded buses will be parked up. Everything that puts our lives and our livelihood at risk ends. Fellow citizens, as a result of the inability of some of us to follow the guidelines designed to keep you safe, the government is now revisiting the measures from last week with a view to escalating them. This will give our medical authorities the necessary mechanism to contain the very real possibility of a community spread of this COVID-19 virus. It will also ensure that there is proper maintenance of supplies and services. In this regard, therefore, a mandatory curfew will be imposed beginning tomorrow at 7 p.m. and will continue until the 6th of April. During this period, every person shall remain confined to their place of residence, inclusive of their yard space. To avoid contact outside of their households, and except to provide in the regulations or as may be authorized in writing by the Commissioner of Police. This means that you are not permitted to go to the beach, go for a walk, or visit your neighbor. You are only to leave for food or medical emergency. And grocery stores and shops will be open, but only on specified days. The days and the stores will be published and announced through GIS and media houses tomorrow by 10 a.m. All regulations announced last week are intact, except for the following. Every establishment or business shall remain closed, including restaurants and gas stations, from 7 p.m. tomorrow. Shops which sell groceries, grocery stores, and supermarkets in each parish will be open for business between 8 a.m. and 12 noon on select days specified by the Commissioner of Police. Essential movement for travel for shops which sell groceries, grocery stores, and supermarkets. One person from each household shall be allowed to leave their residence once during a grocery day to attend shops which sell groceries. Grocery stores and or supermarkets in their own parish and their own parish only. Any vehicle used during this period for this purpose, where the vehicle is an omnibus, shall carry one person in every row of seat, and where the vehicle is a car, shall only carry one person other than the driver. There shall be no for-hire vehicles used for this purpose. Workers at such shops which sell groceries or grocery stores or supermarkets shall be entitled to leave their homes for work on those specified days. The relevant employers shall provide transport for each such employee. There shall be no more than one person in any row of any seat in any of the vehicles provided for staff. Suppliers who are approved by the Commissioner of Police will be allowed to work to supply shops which sell groceries, grocery stores on the days that those shops and grocery stores and supermarkets are open in accordance to the permission given by the Commissioner of Police. There shall be no sale and consumption of alcohol in or in the vicinity of any grocery store or supermarket in any public place. If the manager, owner, or other person in charge of any shop which sells groceries, a grocery store, or a supermarket, or any employee of any of these entities aids, abets, or facilitates the breach of any regulation without prejudice to any other penalty in law, the shop, grocery store, or supermarket will be immediately closed. Hotels are to remain open, excluding any spas, gyms, restaurants, and discotheques therein, and, however, such restaurants may only offer room service. And where a hotel remains open, the staff shall remain on the premises for the duration of the period under regulation. Hotel employers shall bear the cost of board and lodging for such staff members. Brothers and sisters, I am confident that if we all do our part for the next 7 days, in the first instance, we will see the COVID-19 tide changing in our Tri-Island state. I thank you, and may God bless us all.
The preceding was an address to the nation by the Honorable Nickolas Steele, Minister for Health, Social Security, and International Business.
Jerry, why government trying to change laws and regulations relating to the electricity sector?
Suzanne, do you know that the government sold majority shares in the then government-owned electricity company?
You're serious? Grenada was owned by government? So how much they sold the company for?
The NDC administration in 1994 sold 50% of the shares to an American company for $15 million.
$15 million? You call that sell? That was a giveaway, man.
Well, I'm happy someone like you said that.
So, what the NNP government trying to do now?
Suzanne, the main reason the government is trying to change the law is to ensure that ordinary Grenadians like you pay less for electricity. Do you remember when we used to pay more than $2 per minute for some telephone calls? Well, today we pay as little as 30 cents per minute for local calls. That's because the NNP administration took the bold decision back then to change the law and open up the telecoms market.
Boy, I remember how much I fought against that. The thing is, I never trusted that plan. But now I've seen the benefits. I can even talk to Tom, Dick, and Harry for free. Jane, Jill, and Mary.
Well, I'm not concerned about who you talk to. But more importantly, Suzanne, how much was your last electricity bill?
Don't go there. I was just disconnected. I can't even afford it.
That's why the government is trying so hard to find a way to reduce the cost of electricity in Grenada. We have the highest rates in the region.
COVID-19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy. To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70% is ideal. When you cough or sneeze, cover your nose and mouth with a flexed elbow or a tissue. Dispose of the tissue immediately and then wash your hands. If you notice someone has a fever and cough or other symptoms of respiratory illness, avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.